The global numbers of those afflicted with Alzheimer's and dementia are growing. In less than 40 years, they are expected to triple. There have been very few significant advances in treatment in recent years, and as such, global efforts are afoot to help patients, their caregivers, and healthcare systems cope. Joining us now for more on those efforts, here's Dirk Pilat. He is Deputy Director of the OECD Directorate for Science, Technology and Industry. Maria Carrillo is here. She is Vice President of Medical and Scientific Relations with the Alzheimer's Association of the United States. She's out of Chicago. Drew Holzapfel is here. He is Executive Director of the Global CEO Initiative on Alzheimer's disease. He's out of Washington, D.C. And Mimi Lowy-Young is the CEO of the Alzheimer's Society of Canada, and we welcome everybody to our table here in Leaside in Toronto. Dirk, I forgot to mention, you're from Paris, so we really have quite an international gathering here today. We mentioned these numbers off the top, but I think they bear repeating because they are so astonishing. An estimated 44.4 million people living with dementia worldwide, and as the red line on that graph indicates, these numbers are expected to increase to more than 135 million by the year 2050. And if we just look at Canada, it's 750,000 almost currently living with dementia, and that number expected to double by the year 2031. All right, just before we start our discussion, Mimi, maybe you can help us with a distinction here. I hear people talk about Alzheimer's and dementia, like they're two different things. Why do they do that?
Actually, a large majority of people who have dementia actually have Alzheimer's disease. So it's dementia is the overarching description of the disease, and Alzheimer's is one type. We have Lewy body disease. We have other types of diseases that come under the umbrella of dementia.
So dementia in general, but yeah. Alzheimer's is a particular type of dementia.
And make up the most number of people
most number of people who've got it. Okay. Maria, we showed you the numbers off the top. Are we ready for the coming onslaught?
Well, we certainly don't feel that we are as a community. I think I speak for all of us in this room and for the entire community of Alzheimer's disease researchers and the enterprise. We know that today that 44 million global number costs us over $600 billion, and that number is set to escalate by 2030 to 1.2 trillion. So we are not prepared as a country ourselves in the U.S., and I certainly don't think any other country feels exactly prepared, but that's one of the reasons why we all came together here in Toronto under the auspices of the OECD.
If we're not ready, Drew, why are we not ready?
Well, it's a great question. I think we're not ready because if you look back over the history of how we've dealt with other diseases, in the 60s we declared a war on cancer. In the 70s we declared a war on heart disease. In the 80s we rallied around HIV and AIDS. So Alzheimer's has not had the same attention paid to it, both in terms of public support but also funding. And we're starting to see that change a little bit as society starts to realize that the numbers that you said at the beginning are are becoming so large that we have to deal with them. But there's still so much that can be done.
Quick follow-up here, though. Sometimes those wars are real phony wars, right? Like the war on drugs is a big bust. Everybody knows it. The war on crime, all these. Are you sure you need a war on Alzheimer's?
Well, if you look at the war on cancer, it produced results. And you got better medicines, you got better biomarkers, and you had a society that was responsive to cancer survivors, families who were experiencing cancer with their loved ones. So in this case, I think absolutely.
Dirk, help us understand why, unlike with many other afflictions, illnesses, conditions, diseases, and so on, where there have been great breakthroughs over the last 10, 15 years, there's been almost nothing in terms of medical breakthroughs when it comes to dementia or Alzheimer's.
Well, I think first the issue is again the funding. I mean, I think we haven't really seen the effort which has been there in cancer, which has been in a lot of the other diseases. So I think that's part of the issue. I think the other part is as Mimi was saying, basically this is a very complex disease. There's a lot going on here. So some of the science isn't really there yet. And partly that is the effort which we need to make. We need to get the funding there. And also that has meant that for pharmaceutical companies, it's really been hard to take that science, which wasn't really there yet, and take it to a drug. So I think we've seen over the past 15 years or so about 115 drugs which went to clinical trials, and only 3 or 4 of them have come out of that and basically have been approved as drugs, and they only treat symptoms. So we're not there yet. So it's really, I think, this whole sustained effort throughout the innovation process, which needs to happen, and that's what we are trying to work on at the moment.
It sounds maybe like very little progress has been made in terms of research or understanding how Alzheimer's or dementia works. Is that fair to say?
Very fair to say. It is an extremely complex disease. We know that. We don't know the cause and we don't know the cure. We know starting to understand some of the mechanisms of the disease and what's actually happening.
Mechanisms meaning what?
Meaning in terms of what's actually going on in the brain and what are some of the changes that are happening, but we don't know cause and effect. The other big issue is that we now understand a lot more that the disease starts at least 20 years before the first symptoms appear. And therefore, the reason for a lot of the drug trials that have failed is because we're treating the people too late in the disease process.
So by the time it shows up, and you can see it show up, you may be 20 years in and it's too late to do anything about it.
Well, and that's why I think the whole effort of trying to understand the mechanisms what's going on in the brain is so important, and why we need to invest dollars into research to be able to explore that even more than we're doing now.
Is the diagnosis of this disease, I mean, are we making any headway on it? That sounds not good at all, 20-year lead time.
You know, I would really say that we are making some progress that may not be demonstrable to our patients and families. You know, my own family is affected by Alzheimer's disease, and so I wish I could say that my mother-in-law has experienced some help in that direction in terms of changing the course of her disease, but she has not. But the reality is that the scientific community has seen quite a bit of progress, and we have actually taken some steps, the Alzheimer's Association, the National Institute on Aging in the United States, to redefine the diagnosis of Alzheimer's disease. And you know, a part of what Mimi just mentioned is that we acknowledge that the disease didn't start with the symptoms, that we acknowledge that actually there were some biological changes there prior, so that we can tackle this similar to how we look at cardiovascular disease. That if you have high cholesterol, I'm not going to wait for you to have a heart attack to treat you. And so now looking at those types of changes in the brain and in the body that are reflective of potential dementia down the road, we're looking at how to treat that now instead of waiting for the dementia symptoms to set in.
So, Drew, let's look upstream then. In the same way, if you can look at somebody walk down the street and say, you're a heart attack waiting to happen. Can we do that for dementia by changing things upstream so that we just prevent people from getting it at all?
Yeah, so it's a great question. So there's been a lot of important work that's been happening in the prevention field, namely this summer in Copenhagen at the large international conference held by the Alzheimer's Association. There's an important study that came out from Karolinska Institute. It was the finger study, and what it essentially did was gave a recipe for how you could prevent or reduce your chances for Alzheimer's disease. And it's really as simple as whatever's good for your heart is good for your mind. So exercise, diet, social engagement, and these are going to be the keys to preventing the chances of having Alzheimer's.
Starting at the earliest of ages, I guess, eh?
Absolutely.
Right. Dirk, you're with the OECD.
Correct.
Now, I'm familiar with the OECD. That's an economic organization, or at least I always thought the focus was on economics. What are you doing involved in a health issue?
Well, the OECD actually works on almost any policy issue which governments work on. So we work on health policy, we work on social policy, we work on science innovation policy, and we work on economic policy. And I think if you really want to tackle this issue, you really need to bring all these areas together. So the meeting we had here in Toronto was really trying to bring together the people at the OECD who work on health policy and the people who work on innovation policy, because it's really about care and cure. We need to do both things at the same time. But I think there's also an important economic issue here, because basically the cost just basically to the care system at the moment already globally of Alzheimer's is about $600 billion globally, and that's going to be rising. I mean, because of the numbers you cited, I mean, it will be rising very quickly. So it's very hard to sustain that for governments, and we need to find a different way of developing our care so that we can actually sustain that. So it's about care and cure. We need to do both sides of that, but it is an economic issue, I think, as well, basically, because there are important impacts.
I guess, Maria, that $600 billion 15, 20, 25 years down the road is going to be well over $1 trillion.
It's 1.2 trillion by our estimations.
Okay, so
we cannot afford it.
No.
Nobody can.
Right. So
so what we really need to do is focus on care today and cure tomorrow. And that's really the focus of all of our discussions is if we delay, just even delay the onset of the dementia symptoms by 5 years, we could be saving countries billions of dollars, not only in economic costs to the healthcare systems, but I'm talking about caregivers and their informal care at home, which is about certainly $17 billion in the U.S. alone. We have in the U.S. alone 15 million caregivers. So if you think about the costs, the human costs, the family costs, the healthcare costs, it is really something that has to be taken care of and addressed by governments today.
Mimi, though, here's the tricky part. I think in the last Ontario budget, the health budget now is over $50 billion. It's 47% of the Ontario program spending, or 43, something like that. It's up there. Everybody wants their piece of that pie. I mean, hips and knees wants it, cancer wants it, heart wants it. You know, how do you make your case for it?
Well, I think two perspectives. One is greater investment in research. We really need, and that's critically a role of the federal government to support that. And they have with the recent announcement of the Canadian Consortium on Neurodegeneration and Aging to bring 340 researchers together in Canada to look at biomedical research, to look at clinical research, and to look at quality of life research. And that's the point around quality of life research. We need to know what are the best interventions, best way of delivering care and support to families and to people with the disease so that they can live longer in the community and reduce the opportunity or reduce the need to be admitted to a long-term care facility, to keep people in the community as long as possible. So the shift of care from focusing on acute care or long-term care, but in community.
Let me just follow up with a broader American example, because you've all talked about the need for sort of the political infrastructure of all of the world's countries to be more seized of this issue. And, you know, without being an arrogant Canadian coming down on our poor American cousins here, your government looks completely dysfunctional right now, if I may say. How do you get the politicians south of this border to focus in a way that you want them to?
Well, I think the G8 action that was started by Prime Minister Cameron is a very important effort to rally not just the U.S. government but the international community. The setting up the legacy events as part of the G7 that will move forward, and one happened last week in Ottawa between Canada and France and the other G7 nations, moving that to the U.S. and then asking the U.S. to play a role in sustaining this important effort is key. The U.S. is the largest funder of Alzheimer's research in the world. As it should be. As it should be, and there's a lot of room for improvement. And with the recent passage of the Alzheimer's national Alzheimer's plan, we're starting to see examples of where the United States is catching up with other countries and hopefully leading in the near future.
But you work in Washington, right?
I do.
Can you get anything done down there right now?
Sure you can. Sure you can. If you find the right people and the right issues, you absolutely can. And we are seeing growing amount of support for Alzheimer's.
Okay. Maria, let me shift to the workplace for a second. Obviously, it's different in different jurisdictions around the world, but in many jurisdictions, and in more jurisdictions, there's no mandatory retirement age, which means people are going to be, presumably, if they want to, working in the workplace longer. Dementia is going to visit the workplace in the future in ways that it hasn't before. How do employers begin to think about that?
Oh, that's a great question, and I think today employers are forced to think about it more and more because so many people have family members who are affected by dementia. We certainly know that Alzheimer's being the largest of that type of dementia, and we certainly have a program with over 2,000 employers that we work with through an Alzheimer's workplace program that allows them to host internally on their intranet, for example, tools for how to help their employees find support, find respite hours, certainly find tips on how to deal with this. I think employers understand that not only the healthcare costs for caregivers are astronomical because they neglect their own care on behalf of their loved one. That care in the U.S. is estimated to be over $9 billion, but also the workplace hours. Half of the workforce that has to take time off for their caregiver are asking for leaves of absence. A fourth of them are asking for just times off during the week. This is a critical time for employers to think about how much productivity is lost as well if they don't partner with their families.
Have we thought about this in the province of Ontario, how we're going to deal with it?
Absolutely. The Alzheimer's Society of Ontario has worked closely with the government to find ways of, similar to what Maria just described, tools for employers, but also to recognize accommodation for an individual who may be diagnosed with the disease and how to help them transition while they're at work and then ultimately out of work in terms of continue being productive and being able to contribute in one way or another.
Do I assume it's illegal to fire somebody if you found out they've got Alzheimer's?
Well, I think that's an interesting question, but I think we're starting to deal with that now as people live longer, stay at work longer. So I think it's an issue that we'll be looking at, but you cannot fire somebody for, as I understand, for the sickness.
Steve, it's an important point about the role of the employers, and I think one of the most exciting things that came out last week from the Canada-France G7 Legacy event was the announcement by the health minister that there is going to be a Canadian employer-focused effort around Alzheimer's and dementia. And the Global CEO Initiative on Alzheimer's Disease represents 14 global companies, and we've seen our companies respond in really, really significant ways to make the culture of the workplace more supportive of caregiving and more accepting of Alzheimer's, and that's a huge step.
So I'll speak to that. That the National Minister of Health made an announcement on Dementia Friends, which is a program that will go across the country to engage the private sector as well, but to educate people about the disease and also how to interact with people who have the disease, both in communities and so on, but also at work. And also to support caregivers, which is really important in terms of accommodation and giving people the time off and some of the work that's being done federally around supporting caregivers as well.
Dirk, you wanted to add?
Well, I think the other thing which is really coming up, that a lot of companies are also really interested in trying to keep the skilled workers that they have longer. So there's literally, in some of them, really a commitment to try and think, well, what they can do to develop care, but also to sort of look at the cure side. So I think we have an aging population in many countries. We will have problems with the workforce in many cases, and to try and keep people longer into work will be an issue, I think, in many countries. The other thing I wanted to add is that we've done a little bit of work at the OECD looking at basically to combine work with care, because I think we know that the challenge for people who really do full-time care at home is really large, and a lot of people actually have mental problems, sometimes depression. Is very hard if you have to do that constantly. If you do the combination where people actually can also be working part-time, actually it's a lot better. And to find those types of combination, I think, will often mean that you have to work together with employers and really try to find those solutions. So there again, I think the whole issue of working together, partnering, is really important.
Well, let me pick up on that. And Maria, I think in the past, most countries have had their own individual approaches to dealing with this. There seems to be a more international collaborative effort now to deal with this. What are your hopes for that?
Well, I can certainly say that we have great hopes, for example, even for the Canadian plan that hopefully will be announced very soon to tackle Alzheimer's disease. And because, for one, in the United States, one advantage we've found with the national plan to address Alzheimer's that the Alzheimer's Association actually wrote and helped pass through Congress, has really rallied all of the resources within the country, because there are many. There's a Department of Aging, there's the VA, the Veterans Administration, there's the Department of the Defense, there's the National Institutes of Health. I mean, there are so many areas that can actually work together to coordinate support within one country. Added to that, if you can then contribute all of the country plans that can actually coordinate and work together, I think that has great potential.
America has a national strategy, yes?
That's correct. It was passed 3 years ago.
That raises the next question. Canada. Sheldon, if you would. 13 countries around the world have some form of national dementia strategy. Canada is not among them. Ottawa could be taking the lead in helping to develop a comprehensive health human resources plan that assembles the right mix of healthcare providers to properly care for the 747,000 Canadians with dementia. We need more geriatricians. There are only 260 in Canada. And we need to fully harness the great potential of multi-professional primary care teams. That's the new president of the Canadian Medical Association who said that. Why don't we have a national strategy in Canada?
Well, the reason we don't have one is that we actually have many components of a national dementia plan. We have outstanding research going on across the country. We have many elements of a plan that you may see in the US, the UK, Italy, soon to be announced, France.
Doesn't sound coordinated.
Well, the idea is that what we're proposing to the government, to the federal government, is to create the Canadian Alzheimer's Disease and Dementia Partnership that would really convene and bring thought leaders, researchers, industry, the Alzheimer's societies together, including people with the disease and their families, to actually define a comprehensive, integrated plan that has clear objectives and clear targets. And that is what we've proposed to the government. But we have various elements. As I said, the announcement of the Canadian Consortium on Neurodegeneration and Aging brings together all the researchers. We're doing tremendous work across the country, but people aren't aware of it, and part of it is the jurisdictional issue regarding provinces actually delivering health care versus the role of the federal government, who can put money towards research and who can set some national standards and national policies with regard to dementia care. So I think that's why we haven't seen the plan, but we have many elements of it that I think we're feeling quite positive that the government has made recent announcements, including, as I said earlier, Dementia Friends, which is again a way of raising awareness and focusing on the disease.
Drew, can you make the kinds of progress that you need to make if you don't have a clearly articulated national strategy?
If you don't set goals, I don't know how you would imagine that you would have progress. So I think you absolutely need that. And if you look at other countries that have developed plans and the outcomes from those plans, you see the value. And France was one of the first. And the research and care delivery improved dramatically. The problem with these plans, as the political winds change, the plans get more or less attention. And we've seen that in France. That's why Prime Minister Cameron stepping up and taking the G8 mantle and making it focused on Alzheimer's was so important.
Maria, why does everybody want to be a cardiologist and no one wants to be a geriatrician?
Well, I can tell you that we have that same problem in the United States, a lack of a dearth of geriatricians, and it's very unfortunate. I don't understand why our younger people don't see the fact that we're an aging society. They're going to have jobs. We're going to need them. So it is very unfortunate. One part of it, of course, is economic. In the United States, they certainly get paid more if you're a cardiologist than a geriatrician. So perhaps what we need to do as a part of our plan as well is to think about how we can incentivize the young people to actually look at geriatrics as a sexier science to go through. And
pay them more? Is that the idea?
I think that would be one way to do it.
We're not doing too well on this either, are we? No.
No. And I think the issue is that in terms of engaging future physicians or future medical students and understanding the importance and how these will be where the numbers are in terms of the people we need to care for, and those are people with Alzheimer's disease and dementia and their families to support them. And I think we have to raise the awareness of how important it is to have people like geriatricians and other health professionals to be part of the health system and what role they play.
Is it the same way in Europe, where everybody wants to be a cardiologist or no one wants to be a geriatrician?
Not entirely sure about that, but it's probably an issue. I mean, I think pay always matters, so in that sense, and of course there are topics which people, well, are more interesting perhaps, or people find more interesting, so that's always a challenge, I think, in every country to some extent.
As we try to understand what a national coordinated plan would look like, I want to go through a bit of a checklist, if I can, here with the group, and let's figure. Let's just sort of unpack each one of these elements and figure it out. Starting with caregiver support. That's obviously a huge part of the plan. Maria, talk to us about the significance of that being part of a national plan.
We certainly know at the Alzheimer's Association in the U.S. that caregivers bear the brunt. We have, unfortunately, over 15 million caregivers for 5 million Americans. And we know also that 2/3 of those are women. So we're not only focusing on caregivers, we're focusing on the issues that women deal with. And Maria Shriver in the United States is one of our champions, helping us move that forward, creating plans with the federal government so that we can actually disseminate them across all of the federal agencies, because they support caregivers on many, many levels, is really the key. The Alzheimer's Association can only do so much. We have over 80 offices across the country, but we can't touch every single person. So we are looking to our national plan and to the coordination of our government to help us support these caregivers.
Did he, I'm just trying to remember, did her dad die of dementia, Sergeant Shriver?
Yes,
he did.
Sarge. unfortunately, just recently.
Yeah. Okay. Quality of life. You want to pick up on that?
Sure. Absolutely critically important. And I think it really starts in as simple as listening to the patient and building a system around the patient.
Research.
Really important. I think we've talked about it quite a lot already. I mean, I think to really get the science there, to get the research going is extremely important. And I think that also needs to be a bit of a coordinated effort in the sense that we need to do this globally. We need to put all the science together because I think, there's so much which is needed in this area. And this is one of the things we were talking about over the past few days with the Ontario Brain Institute to try and see how we can better do that, how we can better sort of strengthen our efforts together and really move forward. Because at the moment, globally, the US is the lead, but probably globally it's still a very small amount of research which is being done. So we really need to scale that up very quickly.
Dirk, normally there are no flies on us on this program.
I know.
But there's one that loves you right now.
It's been bugging me.
Anyway, he obviously has a thing for Parisian people, and there you go.
I'm Dutch.
There you go. And Dutch, yes.
It must be that.
You're Dutch living in Paris. That's right. I got to do it that way. Mimi, I imagine it's got to be awfully difficult if you've got research happening in Paris, in Berlin, in London, in Toronto, how do you begin to coordinate all of these different efforts?
Well, I think we've had our preliminary discussions through the legacy events, and I think some really good, and also the Alzheimer's Association International Conference that happens every year that brings researchers from all over the world together to actually have discussions about how to share, how to work together. And I think we also have a large number of international efforts where you have all countries coming together to work together on specific projects. We have a number of Canadian researchers who are doing research in partnership with other countries, and this is something that we've been promoting and encouraging because, again, this is a disease, this is an international disease with international crisis, and we are all having to work together to pool our resources and to leverage our resources to be able to use the money for research in the most effective way.
Drew, let me follow up with you on that because, of course, America has so many top-flight universities, I presume that are both nationally funded and funded by the states, that are working together and in deep competition with one another as well. How do you work all that out?
Well, I think the starting point is having an aligned and transparent research plan. We're taking right now one shot at a time and failing, and progress has been too slow. So creating transparency, allowing collaboration, allowing data to flow from centers, allowing patients to flow from centers. These would be the basic elements that would help speed a cure to the market.
Maria, as we continue on our checklist here of things that would make up a national strategy to take care of dementia, I have something called the surveillance system. What's that a reference to?
You know, the surveillance system is most likely a reference, and I'm sure this is relevant to Canada as well, is how we can actually create a way to keep an eye on the community at large. Because we don't want to be reacting late to any of these things that happen in our families. Unfortunately, in the United States, our diagnosis comes usually when it's a moment of crisis, right? And so that is a problem. So that's a part of the surveillance system, is how can we keep track of our communities at large to make sure that when we observe early changes, we actually can intervene before these crisis moments hits. On top of that, we sit with the ability to actually survey the entire enterprise across a country, right? What's happening across the country? What are the needs? Where do we have to put more resources or less? And so that really takes a coordinated effort. We're certainly working on creating that with our national plan, but it takes time. I think that creating the plan is the first step, and actually actuating and operationalizing the plan is really then the challenge thereafter.
You can't, though, what's America's population, 330 million now or something? You can't put 330 million people through an annual brain scan to see if they're showing signs of dementia, right?
That's correct, but there are probably other ways that this can be done. And in recent years, Medicare, as part of their annual wellness visit, has started a cognitive screening. And that's an important step. But improving the way that we detect and diagnose the disease would really help drive this, how we address the problem forward much faster.
I see you vigorously nodding. What can you add to that?
Well, you know, I'm just so excited that Drew brought that up, because the annual wellness visit is really, I think, going to be a very important part of in our system. The Centers for Medicare and Medicaid really are the main, providers of health care for people over 65. And that annual wellness visit includes now, for the very first time as of last year, a cognitive component. I think it's amazing that we've always, covered care regular checkups from the neck down, and never thought about the actual machinery and computer that actually runs everything. And now that we actually have that component, it will help us with that surveillance and catching things a lot earlier, so that when you do notice some changes annually, you can actually address them early on without waiting for that crisis moment.
Do we do that here?
So the Alzheimer's Society of Canada's last year's awareness campaign was early diagnosis. And it was not only to educate the public and people, but also physicians. And we spent a fair amount of time with the College of Family Physicians of Canada to talk about how can we improve the way of physicians actually interact with the patient through screening, through initial screening, to be able to do that. So we've had some really important discussions, and that's why one of the key objectives of the National Dementia Plan would be dementia education. And that's educating health professionals on not only how to care for people with the disease, but also how to be able to detect it early and how to do the screening for us to be able to determine who has the disease.
I was just going to say, for education, partly the professionals, but partly the general population as well, yes?
Absolutely, and that's partly why our awareness campaign is to elevate and raise people's awareness about what are the symptoms, signs and symptoms of the disease, but also if there are issues, how to go to a physician, how to ask the right kinds of questions, and how the physician should ask the kinds of questions they need to ask as well.
Okay, next thing on my list, Drew, is best practices. How do you share all of those?
That's one of the things that's so important about coming to Canada, going to London, going to Paris, and creating these international conversations. So it's through these conversations that we learn best practices, and having convenings that we've heard about already today to ensure that those best practices are shared on an ongoing basis is definitely an important piece of the puzzle.
Somebody wanted to add? Yes, Mimi?
Sorry. But also that the research we do to determine where we have the greatest impact on the interventions is also very important. And I know that's really one of our efforts, to focus on how do we determine what are the best practices through research in terms of our clinical evaluations.
Just say that, I mean, usually in our work we typically look at 34 countries, and that helps us to try and figure out what works, but it doesn't always mean that it has to work exactly the same in another country. I mean, I think the context, the institutions, how your health system works, all these things will always differ a little bit, but at least there's a lot we can learn from each other, because we all face the same problem, and I think that's something which is really important part of this discussion.
How do you say dementia in Dutch?
Really good question, actually. I've been gone too long. Sorry.
Okay, good. Next thing on my list, we've got about 5 minutes to go. I want to make sure we get these next two in. A dementia workforce. What's a dementia workforce, Maria?
You know, it really is not only the healthcare workforce, but it is creating that workforce. The Dementia Friends that's going to be launched here in Canada and has already been launched in a couple of other countries is really behind. And that's how do you create a workforce across the enterprise that will pay attention to and be sensitive to changes as we age, because we are an aging population. In the United States, we have 80 million baby boomers that are, you know, as of 2 years ago, started turning 65.
And none of them thinks they're going to get it.
And none of them thinks they're going to get it, but unfortunately, if the statistics prove out, unfortunately, many of them will get it. And we are certainly not prepared as a community to really be sensitive to not only the changes that could happen so we can have early detection, but to the needs that they will face going to the grocery store, attending church, attending services, attending, you know, going to work, coming home. It is going to be really require a community effort.
Yeah, sure, go ahead.
The Dementia Friends thing that we've heard a couple of times, I think it's really important to emphasize as we go earlier, to have a community that responds to people in the community who are living with Alzheimer's disease. Dementia Friends is a way that the front lines of care shift from the clinic out into the community. And when you look at what's happening in other Dementia Friends programs, they're training taxi cab drivers, they're training retailers, so that the patient can live as independently as possible for as long as possible.
That's a great point. What happens if somebody who's got dementia hops into a taxi cab and halfway there doesn't remember where they're supposed to be going?
Well, I can share with you experiences
Go ahead.
that we have, because we've launched with Safe Return in the United States, a program where we have bracelet and also GPS systems, and many other countries have this as well. And I can tell you that my mother-in-law has 3 times wandered and been found in another part of the city and has been brought home by a Good Samaritan. On top of this, in the United States, as Dirk mentioned, there are a lot of cultural differences. My mother-in-law does not speak English. So when she gets lost in Chicago, it gets very dangerous and has the potential for, especially if it's in the winter, for her not returning to us. So these are very important considerations, but they are also culturally, you have to be culturally sensitive.
Just briefly, I mean, I think the idea of using simple technologies, I mean, there's a lot of technology which we now have today. I mean, don't think you have to immediately think about robots or things like that, but just simple things which can help people live a little bit longer, to help them, to track them, basically, where are they? These types of things are really important. The other thing I'd like to mention is from my own country, the Netherlands, which is the idea of a dementia-friendly village, where you basically try to get people around the community really together and say, okay, we have people in this community who are suffering from dementia, let's think about them, let's try to make it as easy as possible for them to live, and that's really working as well. So again, it's this idea of community working together that can help, I think.
And the last thing on our list here of things that would make up a national strategy, public awareness. We still don't know, generally speaking, nearly enough about this, do we?
No.
What do we do about that?
What we're trying to do is educate the public, I think, in terms of public awareness, first of all, about the symptoms, the signs and symptoms, what we can do from a prevention point of view, which I think is really important, and how people can live with the disease with dignity and be able to be respected for who they are through the course of the disease. And I think that raising awareness through campaigns and education and so on is really, really important. And I think we've started to do more and more of that in Canada, and with the help of now the government in terms of Dementia Friends, and our opportunity to spread the information far and wide will be really important.
Of those 80 million baby boomers you just talked about, given the way it's been going, can you make a guess as to what percentage of them will get some form of dementia? Well,
we certainly know that people over 65 are affected by Alzheimer's disease in the United States. With 1 out of 5 people over 65 being affected, 2 out of and then that number increasing exponentially to about half of them over 85. Half of the people over 85 to being affected by Alzheimer's disease. And so, if you think of it that way, our numbers in the United States are set to be closer to 16 million by the time mid-century comes around. We can't afford this as a country, and we're hoping that we can collaborate with the rest of planet Earth in order to tackle this.
Well, I'm glad you all decided today to come to this little chunk of planet Earth here in Leaside in Toronto to have this conversation. It was very, very helpful. Thanks so much to all of you for coming in.
Thank you very much.
Thank you.
Thank you.